Hello everyone. So today we are going to talk about the effect of aging on the immune system. So what do we mean by immune senescence? Immune senescence is age-related decline in the immune function. There is an increase in the body susceptibility of infection because there is a decrease in the immune function. There is also a decreased strength of the immune response. So our bodies tend to not fight infection the way it was fighting when we are younger. There is a high prevalence of chronic conditions, which increases risk of infections, just like diabetes mellitus and hypertension. There is also an increased risk of exposure to pathogens during hospitalizations. So as you know, our older adults, they do get hospitalized very frequently for their chronic conditions. And that's why they are more prone or at higher risk of being exposed to pathogens when they are hospitalized. Please read chapter number 20. Okay. Again, we have talked about this point about the effect of stress on the immune response. So the stressors to the body are in terms of psychological stress and physiological stress. So medication is considered as a stressor to the body because it has some toxins, in addition to different foods, different changes in the body. Okay, so there is some where the organs that are responsible for the immune system are like the thymus, spleen, and lymph nodes. They're very much involved in the stress response. Therefore, stress can affect the function of the immune system. And some stressors are related to disease, as I mentioned, including arthritis, depression, hypertension, and diabetes mellitus, because the body do get stressed about, for example, producing insulin. Okay, so let's talk a little bit about the thymus gland. So as you know, with advancement in age, thymus gland does decline in size, and that's why there is different or a reduction in the immune response. Okay, there is also an increase in the number of immature T cells versus the mature T cells. So the function of the T cell will be declining. There's also a reduction in the response to foreign antigens because of this reduction in the T cell function. There is a decrease in cell-mediated and humoral immunity. Okay, so and all of these factors will decrease the ability of older adults to fight infection. In addition, there is a delayment in the cutaneous hypersensitivity response. For example, I have put one example here, which is tuberculin skin test, which is related to a decline in T cell function that results in a reduced response to foreign antigens. And because of that, it takes more than 2 days. It takes more than when you test it in a younger population. Okay, there are certain immunological health promotions that we need to consider as nurses. Number one, vaccination is a very important thing, and it's a very important aspect of health promotion when we are talking about immunologic function. Such vaccinations or example of vaccinations are pneumococcal vaccine once in lifetime, influenza vaccination, which should be recommended annually, and then the tetanus and diphtheria vaccinations, which should be done every 10 years. Other vaccines like measles, mumps, rubella, varicella, hepatitis A and B are also very important. Other factors important or related to health promotion when we talk about immunological function are stress management, and also effect of stress on the immune system should be educated, or you should educate your older adult about how stressors can affect their immune system. There are stress-related diseases, such as, various infections and, just say, for example, various fungal infections that can happen easily when a person is stressed. Okay, so stress reduction measures are very important, and again, nutrition is also very, very highly important, especially when it comes to proteins, such as chicken, lentils, and yogurt. Um, so anything that is rich in iron, anything that is rich in protein. Okay. So generally, we need to promote a good general health, and specifically, we need to ensure that all immunizations are current and updated, and to assist our patients to maintain skin integrity, because that's where most of the infections gets, or where the pathogens gets into the body. So as I mentioned before, diet or foods that are high in like minerals, iron, in proteins are very important, such as non-fat dairy products, fresh fish, fruits and vegetables, garlic and grains, pure honey, and unsulfated molasses. Okay, again, exercise is a very, very important thing that we need to consider. So regular physical activity can enhance immune function. Fasting, um, we need to assess overall health before we recommend any fasting to our patients, especially if they are taking hypertension and diabetes mellitus medications. But fasting has been proven to improve immunological function. Okay, infection control is very important, such as and it's very important to early recognize infections so that we can treat them promptly with the right treatment. So we need to ensure all caregivers adhere to strict infection prevention and control measures, such as hand washing, of course, and being immunized against the most common infections. And also, the older adults should ensure that they don't interact with a lot of in a crowded places. They don't go to crowded places or with infected people. Okay, we need to overstress about the mind-body connection and how psychologically our immune system can be affected. So maintenance of satisfying relationship is number one. Effects of laughter and humor is very important, and to instruct stress management techniques such as deep breathing, such as walking, and such as talking to the loved ones. There is also a very important point that we need to keep in mind, which is careful use of antibiotics. There are a lot of consequences of overuse and misuse of antibiotics. Of course, you know that resistance is very common, especially among older adults. So we need to educate our older adults, and also as healthcare care professionals, we need to make good decisions before prescribing or recommending antibiotics. And also, antibiotics shouldn't be discontinued. These are the golden standards of using antibiotics. Okay, and we came to an end. I would like to read this question for you, and you will find the answer in your Moodle. So, a 75-year-old patient is suffering from constant infection. Which of the following advice should the nurse recommend to the patient to improve or boost his immunity? Engage in regular exercise, stop taking the prescribed antibiotics, get annual flu vaccine, or drink adequate amounts of water.